Do you sometimes feel like you can't catch your breath, or your body aches so much you can't get out of bed? Imagine having a fever, cough, and feeling completely drained, like the worst flu you've ever had. That's what people with severe acute respiratory syndrome, SARS, often felt during the outbreak in the early 2000s. It's a serious illness that attacks your lungs and makes it hard to breathe. It spreads fast, especially in crowded places. Have you ever worn a mask during flu season? Some of those precautions started because of SARS. It may not be in the news today, but learning about it helps us prepare for future outbreaks. What causes SARS? Think of it like a tiny invisible invader called a virus. The specific virus is called SARS-CoV, not the same as the recent one, but a cousin. It spreads when an infected person coughs or sneezes, releasing tiny droplets into the air. Did you ever sit close to someone on a bus who was coughing? If that person had SARS, you could breathe in those droplets and get sick. The virus can also survive on surfaces, like doorknobs or elevator buttons, for hours. Touch that knob, then rub your eyes or nose. Boom, you might get infected. It all starts with this sneaky virus playing hide and seek in your body. So how do you know if it's just a cold or something more serious like SARS? Imagine this: one day you're fine, the next you suddenly have a high fever, maybe over 100.4 degrees Fahrenheit, 38 degrees Celsius, like your body is fighting a fire. Then comes a dry cough, shortness of breath, and you feel so weak you can't even walk to the kitchen. Headache, body aches, chills, all possible. It gets worse over a week. Some people even need oxygen or help breathing. Remember the flu that knocked you down for days? SARS is like that, but way more intense. If you've been around someone sick and have these signs, don't wait, get checked. How do doctors know it's SARS? They don't guess, they test. It's like solving a mystery. They take samples from your nose, throat, or even blood to find the virus. Chest X-rays or scans show if your lungs are damaged. Back during the 2003 outbreak, there was no exact medicine for SARS. Doctors used oxygen, fluids, and supportive care, like recharging a weak battery. They kept patients isolated to stop the spread. No antibiotics work because it's a virus, not bacteria. Think of it like fixing a software bug. You need the right tool. Researchers tried antiviral drugs, but nothing worked perfectly. Still, care in a hospital made a big difference. Can we stop SARS before it starts? Yes, by being smart. Remember those masks during flu season. Or washing your hands like you touched chili peppers. Those help. Simple things like covering your cough, avoiding close contact with sick people, and disinfecting surfaces stop the virus in its tracks. During the SARS outbreak, hospitals that used masks, gloves, and strict hygiene stopped the spread fast. Ever seen airport temperature checks? That started with SARS. If someone has symptoms, they're isolated, like putting a broken phone in airplane mode so it doesn't mess up others. Is anyone still studying SARS today? Yes, and that's good news. Even though there's no major outbreak now, scientists keep researching because SARS taught us a lot. The big win: it helped create faster ways to identify new viruses. When SARS-CoV-2, the cause of COVID-19, hit, we were quicker to respond because of SARS research. Scientists are working on broad antiviral drugs and vaccines that could one day protect against multiple coronavirus diseases, like building a master key for several locks. Some lab studies use virus models to test new treatments safely. So even though SARS seems gone, fighting it made us stronger for future threats.